It's a medical condition affecting more than 26 million premenopausal women in the U.S. Uterine fibroids are noncancerous tumors that develop in the muscle of the uterus. If left untreated, they can cause serious health problems, including fertility issues and disorders like anemia. Dr. Tara Shirazian is the director of the Center for Fibroid Care at NYU Langone Health. She and her team have created new educational videos to help guide other doctors through conversations on the disease. That includes how to help patients make sense of what they found on social media. Listen to this.
And I was also looking at some TikTok videos that talked about supplements or herbs that could help either reduce symptoms or reduce the size. So I wanted to see what you thought about that too.
Yeah, I get this question a lot because I think women are out there doing research and they're out looking at health information. And so there are some supplements that are anti-inflammatory that could have properties that help limit inflammation and might overall help your symptoms. So I do.
Dr. Shirazian, welcome. We're so glad you're here.
Thank you for having me.
Why did you make these videos for other doctors?
Yes, well, so we already educate patients a lot around fibroid disease, or at least I've been making a real effort in this space to educate patients, but we want to improve the dialogue. We want to improve the options. So half of that are the physicians themselves, are the providers of healthcare. So we want to make sure that doctors and providers, NPs, emergency doctors, all of them feel comfortable counseling women around fibroids, offering them all the options or referring them when appropriate.
You know, starting this conversation can be really hard. So many of my friends have discovered it and then not known where to turn. How do I, as the patient, start the conversation? What's your recommendation?
Yes. So I really recommend that patients educate themselves, especially around options. So making sure you understand what options exist. And you can find that education online, at my Instagram or, in many portals online. So I think that when patients are educated, they can come to the doctor saying, am I a good candidate for radio frequency ablation? Am I a good candidate for a medication? Should I have a surgery? How are we going to watch these fibroids when they're small? What can I do to prevent new fibroids? So I think asking all of these questions is really important, but it starts with knowing what that playing field of options are.
I'm curious about what are some of the symptoms and how open are doctors to these videos? Because it's been my experience, doctors think they have the information. They say get a second opinion, but many times they're kind of annoyed if you do.
Right.
So how open are they to a video just for them?
Yes. So these videos will be CME accredited. So they will get CME credits, which every doctor needs every year, through NYU in this first year. So if people want to watch the videos and get CME accredited for it, they can. So that's hopefully an incentive for some. But I think, I think the goal is just to give them these options and sort of see who uses them, who takes it up, how they use them.
Okay.
Obviously, we can't, make everyone counsel in the same way. But I think opening up this idea that improved counseling will help their doctor-patient relationships is really, really important. And 3.2 billion women are affected by fibroids globally.
That's right.
Yeah.
80% of the globe. So this is an issue that affects every doctor and most patients. So,
Yeah. Real quick, what can we do, spousal support, when it comes to showing up for our significant others?
I love that question. So I'm a surgeon, so I take out fibroids, I remove them surgically, and I'm always amazed that when we take a picture of it, I've had partners that cry visibly when they see these images. Like, this is what my wife or girlfriend was going through. I can't believe it. So I think educating on what fibroids are, educating the men, making sure they understand, bringing them in on the conversation is very, very important.
All right, Dr. Shirazian, thank you so much.